Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. I'm so excited to have Gina on today. Hi, Gina.
Hi, Amy. It's so nice to be here.
Awesome. We're going to talk about everything a fertility patient needs to know about genetic counseling and genetic testing. And we're going to talk all about empowered donation and a little bit more about you and your passion and what you're bringing to, I hate the word industry, but what you're bringing to patients, not just here, but around the world. So let's talk a little bit more about you. You're the founder of Advocate Genetics and a co-founder of Empowered Donation, an education company dedicated to empowering choice in embryo donation. You've been a genetic counselor at PAC Genomics and UCSF Center for Reproductive Health, and you're passionate about impacting the growing field of genetic counseling, and you've worked tirelessly to train new genetic counselors and provide a strong foundation for fertility patients. A former fertility patient herself, you understand the challenges patients face as they try to make sense of the rapid advancements in genetics and fertility medicine. And you work so hard to help doctors like me and patients like mine make educated decisions about their options. So thank you again, Gina, for joining us today.
It's my pleasure. I've been actually listening to your show for quite some time, and it's such a privilege to be here.
Oh, wonderful. So what drew you to the field of genetic counseling?
So I have a kind of a jokey answer because it's the best job in the world, but I think you probably want a little bit more details. To be honest, I was really confused in college. I didn't really fit a box so clearly. I'm interested in almost everything. Medicine felt like a good way to aim high, and so I was a biology major. And I dabbled with animal research a little bit, but I hated it. And it turns out that I'm allergic to rabbits and I'm allergic to latex. And that was just very complicated. Like physically, it was painful to go to my rotations, my research rotations. So I had a little quarter life crisis for a while there. And, I was really uncertain that I ever wanted to touch a patient anyway. I kind of was starting thinking about it and I was like, I love science. I love people, but physically the idea of working in medicine didn't appeal, And so I think that's because I'm actually kind of an armchair philosopher. My second major in college was English, and my favorite thing in life is to read and to write and find interesting people to talk to or listen to. I love podcasts and things. And I believe in people, and I like to learn from people. I like to learn things for people. And I think I'm a good coach, in the sense that I like to help people find their strengths, their knowledge, and their wisdom in coming through challenges. So combining all these things, I had my little my quarter life crisis and started to really question, things, and magic happened. I found this little gem of a field, genetic counseling, and I thought, that is for me. Boom, it's it. And honestly, I have not looked back. The reason I kind of went into fertility is because honestly, I'm just fascinated by reproduction. I think probably like you, I had a nerd level of fascination. It's just never gone away. And since I learned that pregnancy and periods and babies and sex sometimes are all related, I was like, and then I got a peek at the genetics and ethical issues, and I'm like, that is the field for me. Anyway, I went into genetics specifically in infertility because I thought there's going to be so many new problems to solve and new questions to ask and untangle with people. And I thought this is it.
Like having someone like you to talk to my patients just makes me feel so good, because I often worry that when I tell patients, let's say their genetic testing results, they think that something's wrong with them. And I think by us talking about this right now, it's not about talking about what's wrong, it's about how knowledge is power and how this information can help better inform your decisions. And sometimes talking to someone like you would make patients feel like, oh, there isn't anything wrong with me, when I thought that there was so much wrong.
100%. I mean, we all have things in our genes that are different. That's why it's diversity, human diversity, and that's beautiful. I think the issue comes down to what does this mean for you when you find out a genetic issue? And it doesn't mean the same thing to everyone. Everybody has very different personal responses to hearing about something that's genetic. And so it's really a wise thing to sit down and take a moment with it and to spend some time thinking through it with somebody that has been there before with people and to contextualize.
Right. And that word mutation, is there a better word I should use?
Mutation is the proper word in that sense. We can use the word variant. Variant is less stigmatizing if we think about mutation does have a negative connotation, but it's correct. It's just that variant signifies something that is a difference, and variant can be, and what it also signifies something that's more meaningful, which is variants are not always so black and white. There's all these shades of gray, and it really is more realistic and specific that variants have different levels of penetrance and different levels of impact. So I think you could use the word variant, and that would be, I think a lot of people do appreciate seeing it that way, but also understanding that sometimes a variant can be a serious issue that you need to think about. And so, giving that is sometimes helpful.
Right. And how does genetic counseling fit in the fertility world?
I think there's some things that are really beneficial about the fertility world. It's a space where we're really intentional about pregnancy, so we have a little time to breathe and to ask ourselves, are there any genetic risks worth looking at? Sometimes that means we do a carrier screening panel where we're looking for hidden genetic risk, and those are more routine these days. So you might have an opportunity that you might not have had if you had just gotten pregnant on your own. You might not have taken the space to do that before pregnancy, so you might not have known about a risk that was inherent to the specific coupling, so between the individuals there. Or they might, sometimes fertility patients are considering doing testing on embryos, checking for routine chromosome problems, or they might want a better understanding of, the pros and cons of doing that testing, or results that might be a little confusing. Can they transfer them anyway? They might be interested in working with an egg, a sperm, or an embryo donor and want more information that will help their child down the line. And this is a really unique opportunity to gather that information. So I think that it's just more space. You may have more time in fertility patients, purview, like they're thinking about their babies in the future, and so they have some time to reflect. If there's something in the family history that's always made them wonder, they can come and ask questions. Sometimes, there's something we can do about it, because as genetic testing improves, and it's been like everything else in the world these days, it's been exploding. There's a lot of things we can do about genetic risks we see. And some people might want to test embryos to transfer embryos that don't have a genetic condition, for instance.
Yeah. And what can genetic testing tell a couple or tell someone about the egg and sperm that is coming together to make an embryo?
Well, the testing that's often done in advance of a cycle, looking for those hidden risks, might reveal something that deserves reflection. So most of this time, this will be really reassuring. Honestly, the vast majority of couples will find out they're not carriers of the same thing. I mean, they might be carriers of different things because we all have genetic variants, but they might not be might not pair up and match up and make a serious risk. And that said, they might discover something that they want to take action on. It could be a serious issue. They might consider testing their embryos before transfer to select the embryos that are not expected to have the condition. That's called PGT. Or they might look at other options: egg donation, sperm donation, adoption, embryo donation, a bunch of other options that are out there. Prenatal diagnosis, if they decide to do like a lower tech treatment, they do an IUI, and they might decide they want to test the pregnancy down the line. And so these are all the things that we would walk through somebody that was interested in using genetic information to make some decisions.
What would you say to someone that says to you, well, I don't have any of these things in my family, so I don't really see why I need to test for this, carrier screen that you're offering me?
Oh yeah, carrier screening is, the vast majority of us don't have a family history of the condition we'll find on there because it's recessive in nature typically. That means that it can be hidden in generations. And it's only when usually with autosomal recessive, that means that both the sperm provider and the egg provider are carriers for the same condition. And we wouldn't know that. I wouldn't know that by looking at my husband. Oh, you're a carrier for cystic fibrosis or whatever. If you think about the cobbler, it goes with that, because the kids go without shoes. I didn't do a whole lot of genetic testing. I mean, I did some research testing on myself way in advance of my IVF cycle, and so I never even tested my husband. So I don't know what he's a carrier for, but I can tell you I'm a carrier for hemochromatosis, and I'm a Fragile X intermediate carrier. And so we'll find out stuff about ourselves. We don't know this unless we actually do that testing. And the testing isn't perfect either. It's going to give you a limited view of what we think are relevant tests that should be included in these panels at this time. But that is ever changing itself because of technology and more knowledge.
Well, that's funny. I actually tested my husband and I didn't test myself.
I I did the same thing. I did a cancer panel as well. I shipped out for a cancer panel. Like, there are so many things we can do these days if we want to take ownership and learn some things. But it's not for everybody. And so that's the interesting thing, is that everybody has a different sense. My husband, not as interested in this stuff as me. I'm interested. And I'm interested in the sense of, like, I kind of, as part of our couple, as part of our partnership, I look at those things and I'm like, okay, I'm taking his family history, and, like, in the nicest way possible, but helping family members in our family kind of go, oh, is there something I should be addressing? Everybody has different levels of interest in that. And so it's very common for one member of a couple to be like, just what? And the other member to be like, we need to do this testing, or we need to do this, we need to ask these questions. And I think that a lot of people do benefit regardless of how their level of interest at the beginning. A lot of people benefit once they start really seeing it, like, oh, this is about me and my healthcare decisions and my children's healthcare decisions, and this could really help us. I think then most people are like, why not spend the time to really think about these things now?
Right, and especially because a lot of times we're talking to people even before they're pregnant, and to find out this stuff in pregnancy can sometimes be even more traumatizing than learning about it pre-pregnancy. So you and I both probably talk to patients who've learned that they're both CF carriers because they had a child affected by it, and that could be a really tough thing to go through when you're finding that out in pregnancy, for example. So how can people work with you when it comes to, let's say, I love how you use the term egg provider, sperm provider. Usually I say donor, but I actually like the term provider. So your sperm provider, whoever or however, wherever you get the sperm from. How should they be thinking about genetic counseling and working with someone like you or your company for donor egg, donor sperm, or donor embryos? And what can they actually get from the consults that they do with you?
Well, we provide donor risk assessments on the front end for a lot of donor agencies and clinics that run their own egg donor programs, and even for donors that are directed donors that are family members or friends or people. We will often do a genetic risk assessment in partnership with their doctor to help them just know what we can capture at that time in terms of a family history risk assessment and carrier screening, looking at those recommendations. So we often provide that as a front end thing. And then we often provide match consultations too. That's where people can set up a consultation to review what's known. How does this how does this knowledge help in making medical decisions for their child down the line? What are our limitations of this knowledge today? What's going to change in the future? All of those things are really important. But so I would say that I would say mostly on egg and embryo donors that we're really doing genetic risk assessments, because the sperm banks are a little bit outside of our purview right now. We have done a few directed donation consults. And then doing the match consultations with the intended parents. Some of the interesting things that are brought up there that are really about the the genetic risks that we're seeing in a family history, and just looking at that partnership. So for oftentimes when you're working with a donor, you're thinking about these things in isolation. Oftentimes you might have even used your own gametes first. So you've done your own genetic screening, you've thought about your own genetic history, and then things change and you decide to work with a donor. And then it's really a good time to stop and ask, are there any differences now? Are the carrier screening things lining up? Are there any genetic risks coming from family history that we should be concerned about? Things that are not so straightforward from a genetic perspective, but important. Things like mental health history, and so it's just a time to usually reassess and say, okay, does my husband's history now change things now that we're working with an egg donor? Is there anything that it's not lining up that would be good for us to think about? And then secondly, what's the meaning, taking a step to kind of thinking about the meaning of, moving to donor and how comfortable you're feeling. We're not mental health providers, but we are counselors. And with this specialty in genetics and focusing on what genetic identity issues are and genetic risk issues are, it's a really good space for intended parents to just kind of forecast some of the questions their own children might be having and thinking through how they're going to respond to that. And really conceptualizing what it means in this day and age to work with a donor. Maybe that if it starts out in an anonymous fashion, that with the changing of, genetic testing and everything, that's not really possible anymore. So really thinking through disclosure issues from this perspective of what in the future does this really look like for my child down the road? And that's really where my work intersects with Empower. So I don't mean to keep being so verbose.
No, I love it. I love everything that you're sharing. And then for patients who, let's say, have done IVF, and we talked a little bit about genetic testing and PGTA and PGTM, can they do a post-test counseling session with you to review their PGTA report and to get, a completely different, unbiased opinion about their embryos and how they should be prioritizing them if they're abnormal, for example?
Absolutely. And that's the thing, is that this technology is changing every day. Our understanding of biology is changing every day. And what does that mean for embryos that were tested on a platform a few years ago? What does that mean for the tests we receive today? How are clinics different in terms of how they approach these genetic test results? We provide completely unbiased, and we're not affiliated with the lab. So we're here for the patients. We're genetic counselors in their corner because we're here to be an advocate for them, to look at the nature of testing, what we really know from it, and how they can make decisions that are in their best interest.
I want to talk more about empowered donation. Can you tell us about Empower?
I would love to. It's my passion, really. So I'll have to go back into my backstory a little bit. I also fertility patient. Back in 2010 is when I did my cycle, and at the time I was, a younger genetic counselor. I had seen a lot of, because of the patient population we see, I had seen some pretty rough cases. And I think that I went into my stimulation with that, carrying that. And so when my stimulation went really, really well, I didn't really know how to handle it. And I decided to be a little bit, I kind of threw caution to the wind. It was back when egg freezing wasn't really done as much. It was experimental. And so we decided to fertilize all. And then we ended up with a lot of embryos, and too many for my, I knew that I was going to have my whole family in my one cohort. It was pretty obvious from looking at the morphology and stuff. Unless something was a uterine issue, but it turned out not to be, and we turned out to be okay. So ultimately, we ended up with more embryos than we could use. And it really put me in this personal place of like all of my work, everything in front of me, all the patients' hearts I've seen pour out for like this, opportunity, and I'm just given too much of it, and I just didn't know how to handle all that. So over the years, we've decided to become embryo donors. And working through that decision was really complicated for me. It was not easy because it was so personal and so in touch with everything I do professionally that I couldn't separate things. And I had to really go through a lot to get to a place where I could make a decision on what to do. And in that work, I really, had to tangle with my complex feelings. I had to work with, I learned a lot about the donor conceived population, learned about how they're feeling today, the adult donor conceived population. And I started just really thinking more and more philosophically about what all this means, and ultimately decided that I needed to, use my platform to like help other people, tangle through this stuff too, because it's not easy. And especially with people that have been affected by IVF, they've already been through one traumatizing experience often to get to their baby. And then to have this second layer of decision making, it can be really paralyzing. So I joined up with two amazing co-founders, Jen Vesbit, who's also an embryo donor and a counselor, and Maya Grobel, who's an embryo recipient and licensed clinical social worker. And she also did a documentary called One More Shot. You might know about it. And with her husband to showing their journey to parenthood. Anyway, I partnered up with them, and we got this grant to educate people about embryo donation. And so it's really just transformed my life. Like, this all is interweaved. Spending all my time with them, helping to educate and empower families thinking about embryo donation.
So do you think that your platform could one day also be a way for people to find embryos if they, want to be a recipient, or for donors to find a place to, share the information about their embryos for others?
That is our next step, and we're working very hard on it. But yes, we're going to be working on a platform where people can meet and actually normalize this experience, because the thing is that there's not a lot of support for people that decide to donate or decide to become recipients, become parents through embryo donation and donation in general. And that's our goal, is really to normalize it, because it's not just it's not a decision you make once. A lot of times with the new genetic technology, this is a decision that's going to impact the rest of your life. You're going to probably have some contact with this other family. And what does that mean? How do you handle those relationships? What does it mean on the front end? Should you create as many embryos? Like for me, could I take a step back and 10 years ago make a different decision so that I wouldn't be in this place? I could have made a totally different decision that would have completely changed things for me. And yet it's like also really wonderful. Like there's a little girl out there who is genetically our daughter, but she's amazing and she has her own family, and I get to be kind of part of her life too. And that's beautiful. So and not everybody chooses that arrangement, but I think these are the things that, like, when you're going through fertility treatment, you're not able to see the whole picture because you're living in a space that's really scary, and sometimes you just need to have a hand that understands that and can help walk you through what does that mean in the context of everything.
That's beautiful. And I feel like people are so giving now, and I feel like the taboo of being a fertility patient has changed so much that I often have patients from the beginning share with me, Amy, like, I want to create these embryos because I want to pay it forward. And I want to donate embryos if I have extra, and they don't want others to suffer the way that they've suffered themselves. So I see a lot of people out there choosing embryo donation from the beginning. And I always talk to people about knowing the answer to this question, and the question is, what are you going to do with unused embryos? And to have that answer from the very beginning. And of course it can change, because no one imagines that they're going to have unused embryos, right, when they're starting the journey. But some people can tell, like I imagine you could tell pretty early on that you could have them. So it's amazing that you're doing this.
Yeah. I think the other thing that's going to be important for is, a lot of women freezing their eggs now, we might have total different social constructs that develop around this, that people do share genetics and totally different new ways of creating families. Because some people will have frozen eggs, and then maybe down the line somebody else will, that maybe they don't need them, but somebody else in their life does. And so I just think we're going to be developing new genetic and social relationships that they need support for those relationships. And that's where I think my next, I feel like a calling to, like, go and help people, because it's not uncomfortable. I mean, it can be uncomfortable, but it doesn't have to be. Like, we can have new conversations and think through this stuff together, and it can be beautiful.
We have to grow as humans. I mean, with the way the world is right now, we need to make as many people who want to be loving parents, and as soon as possible. So, I mean, I'm right there with you. Advocate Genetics also is empowering people and giving them information, and you're doing so much great work. So if someone wanted to work with you, how can they do that?
Yeah, so through Advocate Genetics, they just go to advocategenetics.com and they can schedule an appointment directly on our site. Physicians that want to work with us, we can, schedule a call and talk about any specific needs that their clinic has for referring patients. And donor agencies as well. So we work with people directly. They don't need a referral from a physician. They can bring their medical records and we can talk to them, even if their doctor doesn't have a relationship with us. But outside of that, we can also work with physicians. And with Empower Donation, things are moving very quickly. So hopefully we'll have a lot more resources available soon, but empowerdonation.com is where you can find all the resources we already have. And we have webinar series and all sorts of educational materials on that site. And it's just going to be, we're just continuing to provide more support for these, for people that are in this boat.
Well, thank you so much. Thank you for all your work, Gina. It's so nice to talk to you today. Is there anything else you want to share with our audience?
No, I can't think of anything. It's such a pleasure to be here. Thank you so much for having me.
Thank you again.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.